This segment of Delmarva Life is sponsored by Delmarva Dental Services.
Pretty safe to say that most of us have probably received some sort of dental care since before we can remember. I vividly remember having to go to the dentist one time after I was on the playground in elementary school. Wasn't paying attention, walked right between two people who were playing catch, and I took a baseball right to the mouth.
Ow.
Yeah, straight to the dentist on that one.
Yeah. Well, I remember getting fluoride treatments at school as we were sitting at our desks and chewing those pink little tablets to show any spots that we might have missed. Well, obviously, a lot has changed in dentistry over the years, and someone who has seen most of those changes is Dr. Joe Harmon with Delmarva Dental Services. And I recently sat down with Dr. Harmon to get a recap of the changes during his career that has spanned 45 years. Dr. Joseph Harmon is celebrating 45 years in dentistry, and to say a lot has changed in the field since he started in 1979 might be considered an understatement. For one thing, it's no longer a male-dominated field.
Out of 139, there are about 5 females in my class.
Dr. Harmon joined the practice that is now Delmarva Dental Services in 1984. Today, 3 of the 4 dentists who practice here are women. In 1979, those who finished dental school didn't find themselves in a mountain of debt.
The average dentist now owes about $280,000 to $292,000. When I graduated, I owned $12,800, and with inflation it's in the 50s.
Today, that debt can prevent dentists from setting up shop in small rural areas.
Most of them go to the big cities, and also people prefer big cities many times anyway. And also they go and work in corporations, like chains, large corporations, because sometimes they'll help them with their debt.
Fortunately, Delmarva Dental Services was able to attract top-notch dentists with local ties.
The dentists here, 2 of them grew up here, and 1 of them had ties here when she came.
The same applies to dental hygienists and assistants.
It's really hard to find hygienists. It's a hygiene shortage all over the United States. And then you run into the same thing, the rural issue as well. And you can't find hygienists. They just don't even apply. So, and dental assistants somewhat easier with front desks because they don't have to have they can have business skills. Hygienists are extremely hard. There's not a lot of schools.
To solve the shortage, Delmarva Dental Services is sending 2 dental assistants to dental hygienist school. Dr. Harmon says the biggest changes in dental procedures started happening in the 90s, but not without some controversy.
That was the most turbulent time, and it was also the most fun time.
For one, implants became easier.
So people started replacing teeth with implants, so that skyrocketed.
And surgery became simpler.
They were done in the OR. They did a study and said they could be done in the general office or any office, and they'd turn out the same, so that had a big change.
The 90s also ushered in bleaching teeth.
And then, boom, in the 90s, it was bleaching.
Dr. Harmon says the controversy came from the battle between cosmetic dentistry and functional dentistry.
They improved with plastics, and the plastics had improved a lot, so plastic fillings came in. And then porcelains got better, and porcelains competed with gold, plastics competed with silver amalgams, and then there were function cosmetic wars, meaning people would argue about it. They were persistent. Many of the cosmetic people would just do all porcelain and plastics. And then there were people who just did silver and gold.
Fortunately, Dr. Harmon says the 2 sides met in the middle.
Had to have cosmetics and function together. You couldn't do one without the other. And it had to merge, but it took a while for that to merge in that way.
He says other controversy arose with differing opinions on whether to save a tooth or replace it.
You had oral surgeons who were doing all the implants, periodontists who were doing gum surgery trying to save a tooth, and endodontists who were doing root canals trying to save a tooth. And then it became, is this tooth worth saving, or should we put an implant in? The implant's more predictable, maybe, sometimes not. And then they got in arguments, specialists got in arguments and meetings, and I was a general dentist. I just sat back and listened.
And again, Dr. Harmon says everyone came together on this subject, which ended up being a win for patients.
So implants became more affordable, and also we developed ways of making it easier to do the surgical techniques. And then we developed all kinds of materials that related to it.
By the 2000s, silver amalgam fillings were replaced by newer, stronger, and better-looking materials like zirconia.
So most of the crowns are zirconia now, or porcelain overlaid to zirconia. You can make it a little prettier if you overlay it. That's why they do that.
And like most industries, dentistry benefited immensely from the digital age, an evolution that spanned from computer scheduling to digital records to
X-rays. X-rays went digital, and we've been digital probably since 2007, okay? Well, on a film X-ray, you got a little film X-ray like this. On digital, you can make it like this, okay? So you see things that were there before, but you didn't know it.
even better 3D X-rays, which leads to digital design.
Digital design, before you had to guess where everything was going to go and how it was going to look.
With digital design, a computer-generated 3D model takes the guesswork out.
You can also do Invisalign. You can show people, and this is AI again, you can show people as their teeth straighten them how they're going to look over time. It's like a video. So you say, okay, these are your teeth and here they go over time. You can do cosmetics. You can show them what the teeth are going to look like before you do it. It's a great educational tool, not only educational, but diagnostic and design.
So many changes in the past 4.5 decades, but there are some things that have stayed the same.
Just the one thing I have found that with all the technology, you still have to rely on the old stuff.
For the most part, the gloves dentists use have not changed a lot. Hand tools such as the mirror and explorer and extraction tools remain the same as well. Even the dental chair is strikingly similar. But when Dr. Harmon looks back on the most surprising changes, one thing that he never imagined would happen.
Yeah, I'm busier than I've ever been.
Busier in a business he enjoys and doesn't see himself out of anytime soon.
And Dr. Harmon says that there was a time when it was thought that dentists might become obsolete. That's because of the fluoridation of water. Obviously, that is not the case. And that is why he says he is surprised at how busy he is. And that goes back to the lack of dentists in the rural areas.
Okay, yeah, that makes sense.
So people might not be getting the dental care they need to keep their teeth healthy.
Can't imagine dentists becoming obsolete.
No, me
Can't
neither.
imagine it, actually.